Okay, let's talk about the health-related components of fitness. So this includes muscle strength, muscle endurance, cardiorespiratory endurance, flexibility, body composition. And we're going to talk about these and how they relate to pretesting. But before we talk about the HRC, let's move into blood pressure first, because this is the very first measurement that you should take before somebody starts working out, because we want to make sure that their blood pressure is not too high. And so average is 120/80 for a man, 110/80 for a woman. So they've just recently changed what is considered hypotensive. So in the past it was 140/90. Now they moved it down to 130/90. So you notice there's not a huge range between these two. So I really start to get worried once it's 140/90. I'm not too concerned if they're in that pre-hypertension range. And if you're doing your blood pressure and you notice that your systolic pressure, that's this top number, is high and your diastolic is normal, that's an indication that it's exercise-induced hypertension, or that you're using an automated cuff and it made a mistake. So you really need to understand how these work. Make sure that you rest 5 minutes before you take your blood pressure, and make sure you haven't had any stimulants or vasoconstrictors. So coffee should be taken afterwards, because it can really elevate your blood pressure, especially if you take your blood pressure 30 minutes after drinking some sort of stimulant that has caffeine in it. So manual blood pressure cuff, how does it work? It closes off all blood pressure cuffs close off the brachial artery in your arm, and then it slowly releases that pressure. And then you either, if it's a manual cuff, you're listening for the surge of blood. So the first time you hear that, that's systolic pressure. And the last time you hear it, that's diastolic pressure. If this is an automated cuff, you have a sensor that replaces the stethoscope. And so it's listening. That's the reason a lot of these automated cuffs mess up, is because you may move and a bone pops or you talk. It can't distinguish between a bone popping and the surge of blood. So if it hears a fairly loud sound, it's going to think that's your systolic pressure. Or if it continues to drop and you move and it thinks that's a surge of blood, it could think it's diastolic pressure. It tends to happen more on the systolic side than the diastolic side. All right, so how does it work? So a lot of these videos, if you need to find out what the illustration, all the diagram is saying, in the PowerPoint, I have alt text, so you can just run the cursor over. But I'm going to explain to you what all these visuals mean, so this will also take the place of that. So you pump the cuff up, so this represents the cuff around the arm, and then as it pumps up, it closes off the artery. Then you start to relieve pressure, and then there's a little opening, and then it creates some turbulence as the blood rushes through. And so you, just like in a river, you get turbulence on the other side of a rock. Same thing will happen with blood, and that makes a sound as it passes through that narrowed artery. And then eventually the cuff pressure gets so light that it no longer closes off the artery, and you no longer get a sound. And so the last time it hears that surge of blood is diastolic. So the first time it hears it, systolic. Last time it hears it is diastolic. And so that's the same thing those automated cuffs are doing. And we use the brachial artery. So if you're using an automated cuff, you need to make sure where it says this side on the inside of the arm, it indicates where that sensor is. You need to make sure that's right along the brachial artery. All right, exercise and high blood pressure. What we're most concerned about is a hemorrhage. So we don't want a ballooning of the vessel, which is an aneurysm, and we don't want that to rupture. So think of that like high water pressure in your house. If the pressure gets too great, a pipe can burst. Or if the pressure stays too great for too long, so for the lifetime of the house, those pipes are more likely to spring a leak because of the stress from the pressure. Same thing happens in your body. It does stress to your kidneys, a lot of your major organs, to the vessels. It will damage them over time, especially the kidneys. We're most concerned with the kidneys and some sort of stroke. So kidneys think more long-term, stroke think more short-term and long-term. So health-related components of fitness. So we talked about the health history questionnaire and how that was used in conjunction with the pretesting. So when I say HRC, those health-related components, think pretesting. That's really how we're applying that knowledge. It's important information for you to know. So we use it as an assessment, and the measurement we use to improve our fitness or diet or both. So, and it's used for safety as well. And this is all an example of exercise testing and prescription. For those of you that are kines majors and you move on, understanding these health-related components and the health history questionnaire, and really the fundamental knowledge from this class will really set you up well for exercise testing and prescription and even exercise physiology. And some of the goal-setting stuff is you'll see in sports psychology. So you're getting all the major elements here within this small little concepts course. All right, health-related components. So you have non-physical measurements like body composition and flexibility. We call those non-physical because you don't really have to do any exercise to measure these. So body composition can be done with calipers. It can be done with a DEXA scan, which is like an x-ray. And then you have physical measurements. So like muscle endurance, muscle strength, cardiorespiratory endurance, these fitness-related components that you actually have to do exercise to measure. So those are what most people think of when they think of a physical pretest. So body composition. You've got girth measurements, which we're going to do. It's also a good comparison. So the more measurements you take in different forms, the more reliable your results are going to be. So you can look at them and say, hey, girth measurements are telling me my body composition went down. My bioelectrical impedance, my body comp test is telling me I went down. Maybe you use calipers along with it. They're telling me it went down. So if you get all these measurements telling you the same thing, then you're like, okay, I can trust that, yeah, I've lost 1% body fat. Now, they all have measurement error. The only one that's really super good would be the DEXA scan. Even hydrostatic weighing and body pods have not a real large measurement error, but they're nowhere close to the DEXA scan. So that is body composition. In this class, we're going to do girth measurements because all you need is a tape measure. And we're just using waist and hip. All right, so waist and hip, what's good? So anything less than 0.85 for males and anything less than 0.75 for females is excellent. And so most of you will probably be in the good or average range. Think of it this way. So if your numerator is greater than the denominator, that means you have a big waist, and therefore you probably have a lot of fat across the midsection and probably have a lot of visceral fat. So we don't want that, because the more visceral fat you have, the more likely you're going to develop some sort of hypokinetic disease, which just means low movement. So those metabolic diseases like diabetes, diseases like heart disease and cancer, all of those are associated with having too much body fat, and especially visceral fat is dangerous. So females versus males. So males tend to carry most of their weight in their waist. Not all, but I'm just saying the majority. So if we're going to generalize here, we're going to say males have more android obesity than females. Yes, some females have android obesity, which is that apple shape, fat around the midsection. Females, we're going to generalize here again, tend to store a lot of their fat in their hips and buttocks. So that's called gynoid obesity. Yes, you see some males with that too, but on average, females have a higher rate of that. So if you're getting numbers for males that are greater than 0.95, meaning that the numerator is much larger than the denominator, then you have a lot more fat across the midsection. Same thing with females. All right, let's scroll down here. Body pod. You may see this on trucks going around town. They'll park outside gyms sometimes and do air displacement. And the good thing about it is you don't have to get all the residual air volume out of your lungs like you do with hydrostatic weighing. Hydrostatic weighing, if you've ever done it, it's kind of freaky because that's what works off water displacement. And it can be scary because you got to get all that residual air volume out and then sink yourself. So if you're not comfortable in water, you'll probably want to opt for a body pod if you want to do air displacement. And then based on how much air is displaced, or if it's hydrostatic weighing, water is displaced, they can get an estimate of percent body fat. And that's basically, it's based on your weight, buoyancy, because fat is going to be buoyant, muscle is neutral, bone will sink, and they can get an estimate based on that. So DEXA scan, X-ray. This is the best way. The only problem is you're exposed to X-rays. Right? But if you want a true estimate of your percent body fat, this is expensive. Some places have it though. Some universities that do research. Best way to go. That's the gold standard. Flexibility. So this is a sit and reach. You've probably done this in elementary school. And it's only measuring, and there are some other tests, but the sit and reach is the most common. So it's going to measure hamstring and lower back flexibility. The problem here is if you got really long legs and little T-Rex arms, you're not going to do very well. But if you're like me, where you have a wingspan that's longer than you are tall, so I have a 78-inch reach, but I'm only 6'2", I do really well on this because I've got long arms. But we have a lot of normative data on this. So if you don't know what normative data is, it's just, let's say I have 1,000 people and they've all done this test, and then we get averages from that based on their age and we put them in columns. That would be normative data. This is the norm. This is what an average person would do on this test. So you can find out, are you above average for your age or are you below average? And they're normally posted here on the side. That's why I keep. But you could build this yourself. So sit and reach, we're actually doing this. Just take a box, take a yardstick, put it on top, put the 15-inch mark right here where your toe line is. So right at the edge of the box, and then see how far you can reach with increasing numbers going this direction. Have somebody hold it for you, but your back needs to be flat up against the wall. Muscle endurance. So this is like if you've ever been in the military, push-ups. They used to do push-ups for 2 minutes. Now you're starting to see tests where it's more push-ups to fatigue. That's what we're doing. So we're going to test our upper body muscle endurance, push-ups to fatigue. So once you start, you don't stop. Standard or modified. Just let me know what you did. I'm not putting this in a database, so I don't care. If you're female and want to do standard, that's fine. I know a lot of people will require females to do the modified. I don't care. Whatever you want to do. All right. So then we test muscle endurance for the core. We're going to do sit-ups for a minute, so you time yourself. And then we're going to do lower body muscle endurance. So this is one a lot of people don't do, but we need to. So lunges for 1 minute. So let's go down here. So push-ups. So this is modified if you don't know what it is. So you're on your knees, arms about shoulder width apart, and then you go down. If you're a female, put a block out here in front of you and let your chin touch it. If you're a male, put it right here so that your chest will touch it. If you have problems with your wrist, you can use dumbbells, but be careful because those will turn on you. Or you could just put your fist down on the ground. That's a little safer than using dumbbells. If you're going to do standard, the axis of rotation, instead of being your knees, is over here on your feet. Right on the balls of your feet. Arms about shoulder width apart. Go all the way down. If you're a male, your chest touches the block or somebody's fist. Or if you're a female, your chin touches the block. Make sure if it's a yoga block, it's turned on its flattest side. So you're looking for something that is about 2 or 3 inches thick. Don't turn it up so that it's like 6 or 7 inches tall. That's cheating. All right, so standard modified, we talked about it. Sit-ups. And I've got some videos on these I can show y'all if you need them. I can send them to y'all in an email so you know how to do the test. Sit-ups. Heels are about 15 to 18 inches from your bottom. The reason we do that is if you extend them way out here, you're using the weight of your legs to hold you down, but you start using the hip flexors more, and that's cheating. We want to see what the rectus abdominis is doing. So we're trying to take the hip flexors away as much as possible. So those heels, the closer they are to your bottom, the less the hip flexors help you, and it makes it really tough. But 15 to 18 inches, somewhere right in there is what we're looking for. We want the arms crossed. Don't put them behind your head. Don't use the arms to swing up. They stay crossed. Your elbows will come up. They'll touch your knees. Back down. You can have somebody hold your feet or tuck them underneath some sort of chair or something weighted that'll hold you down. Lunges. Make sure you step out far enough. If you take a little baby step, your knee will go out in front of your big toe. That causes a lot of anterior shear on the front part of the knee, meaning that the femur is trying to shear off and slide off the top part of the tibia, and it puts a lot of stress on those ligaments. We don't want that. If you step out far enough, your knee will stay well behind your big toe. You notice here she's doing a really good job that knee is not extending way out here. And that normally happens when you take a little baby step. If you take a really good lunge, kind of test this out. And so you're doing each leg. So once this one steps out, that's 1. Once you stand back up and then you step out again, that's 2. That's how you're going to count them. Look straight ahead. That helps keep your spine straight. That's really going to be more important, like if you had weight, like if you were doing this with a barbell. You don't want to get in the habit of looking down because you'll start leaning over. You can throw out your lower back. So keep that spine in line. Oh man, I moved that. All right, cardiorespiratory endurance. Resting heart rate is a good measure if you don't want to exercise. You can take it at the beginning when you first start your program, and let's say it's in the 70s, and at the end of, let's say, 10 weeks, you take it again, and now it's down in the 50s. So if you've been doing a lot of running and stuff, that might actually happen. It's an indication that your heart is getting stronger, and therefore it pumps more blood per beat because it fills up with more blood. And it gets all the blood out of it each time it beats. So cardio has a huge impact. Your left ventricle starts to develop. That's the part of the heart that really pumps a lot of the blood, most of the blood out to the rest of the body, is that left ventricle. So people that do a lot of cardiovascular training have hypertrophy occur where the cardiac muscle in that area starts to increase. But also the filling capacity of the heart also increases. So stroke volume, cardiac output, all that increases. So 1 mile walk run is a good test if you want to test your cardio. 1.5 mile walk run is good. I don't care, but you can find normative charts online. The step test is a good one. Like if you already do a lot of running and you know that it's not going to change that much, do a step test. It's probably not something, so you find a 16-inch high platform and step up on it and step off of it and do that for 3 minutes and see what your heart rate is. And then at the end of the semester, you do that again, go at the same pace. Now there is a metronome that you can keep pace with, but nobody can ever keep track of that. But you could put a metronome app. I think it's like 88 for women. I can't remember off the top of my head. You can look it up. You can Google it or ask me and I'll look it up for you if you want to do that one. Here's how to take resting heart rate. Radial is normally used, like if you've ever used some of those watches that don't require a band, they're going off this radial pulse. So you notice thumb is up here. You've got the ulna. If we were looking at bones on this side, you've got the radius here on this side. So, and there's a bunch of little ligaments here, or tendons, I should say. So use the pad of 2 fingers. Don't use your thumb because you have a pulse in your thumb. Or you can find this sternocleidomastoid muscle and your Adam's apple, and right in between there is a carotid pulse. So we use these for first aid, but they're also used for exercise to find out. And so you count it for 10 seconds and multiply it by 6, or you could count it for 15 seconds, multiply it by 4, or you could just look at a clock and count it out for 60 seconds and see what you're going to get, but that's going to take forever. So that's all you're doing. How many times is your heart beating in a minute? So I know I said I'd try to keep this short, but this is a lot of information that you're going to need. We'll keep these as short as possible. So I hope this helps. And again, like I said before, all of these have alt tabs on them. So if you just want to run this through and see what's on the diagram, I just put any description or descriptive words in there that kind of tell you what's in there. But I'm also telling you what's on these in the closed captioning. So if you need closed captioning, it'll be at the bottom of all these videos. And you can also download the transcripts if you need those.